Welcome, friends, to CNS Viewpoint. And today we are going to talk about uh, an important issue. It is January 2022. Let us talk about One Health. There's no doubt that COVID pandemic is a grim reminder of what can go wrong if we do not focus on, the integrated One Health approach to human health, animal health, food security, or safety, or an environment. And despite commitment of governments, despite a lot of progress which has happened over the past decade, or more than one decade actually, since a lot of momentum has been built around One Health, especially when the world was hit by pandemics. So, for example, during SARS, or during previous bird flu pandemics, etc., those were the difficult times when governments came together to find ways for better pandemic preparedness, to for a better way out of the current of the crisis which was confronting them in those times. But actually, we have not been able to. I personally feel that we do not have not been able to, do the kind of progress which was really required, which was so warranted, with so much of urgency in the times. Think of 2003 pandemic, or think of SARS, think of bird flu, think of Ebola, or Zika crisis, or MERS. There has been a lot of alarm bells, in the lead up to COVID pandemic, and and although those were also the very points when more momentum built up for towards One Health approach, but we still see a lot of vertical programs. But having said that, sorry to begin on a bit of a pessimistic note, but I think that kind of realism is also important to have when we are talking about One Health. It is critically important. There's no doubt about it. If there is any way forward, it is through integrated health and development solutions. We need every possible health solution, every possible development solution has to be socially just and ecologically sustainable. There is no other doubt, there's no other way forward. The only way forward is it has to be socially just, it has to be ecologically sustainable. This is totally non-negotiables. And So Dr. Ronilo Abila, he's from World Organization for Animal Health, OIE, and based in Bangkok in Thailand. He was speaking at the 6th Asia Pacific Summit of Mayors, which was hosted by Asia Pacific Cities Alliance for Health and Development, APCAT. And So Dr. Ronald Abila told us that there are in 29 countries there are more than 400 animals that have been infected with coronavirus. It include cats, dogs, tigers, lions, gorillas, kind of deers, minks, and others. So um, this is a very big number. So most likely those animals got infected because they must have come in contact with human beings which were infected with coronavirus. But there is no scientific evidence to show that conclusively that these infected animals can also pass on the infection to human beings. This we don't know that yet. So, but this is alarming. This is alarming because the it also underlines the interaction between human beings and animals, and of course. 60% of infectious diseases in human beings come from animals, and out of that, over 70% come from wildlife. So that speak volumes of the way how human health is so connected with animal health, or interdependent, and in turn to environment. Um, so. I just wanted to quote Dr. Tedros here. Dr. Tedros Adhanom Ghebreyesus, he's the Director General of World Health Organization, WHO. He had said an important quote in, I think, if I'm correctly remembering, it was February 2021. So Dr. Tedros said we can only prevent future pandemics with an integrated One Health approach to public health, animal health, and the environment we share. We cannot protect human health without considering the impact of human activities that disrupt ecosystems, encroach on habitats, and further drive climate change. These activities include pollution, large scale deforestation, intensified livestock production, and the misuse of antimicrobials, along with how the world produces, consumes, and trades food. These are the words of Dr. Tedros, who is the Director General of WHO. He had also said that to keep people safe, One Health must be translated into local level systems. Must be translated into local level systems. No, so this is really good that the sixth Asia Pacific Summit of Mayors brought together local leaders from over 80 cities of 12 countries in the Asia Pacific region to talk about and commit on very specific actions in the declaration, which also includes a focus on One Health approach, integrated One Health approach, which is really important because let us hope these local leaders are able to translate this into action on the ground. Um, um, I just wanted to share one more thing, and that is what I'm looking for right now while I'm scrolling. So about 9 years before the COVID struck us, the tripartite alliance, World Organization for Animal Health, and United Nations Food and Agriculture Organization (FAO) came together to form a tripartite alliance to address to work more on One Health approach, and they decided that in Mexico in November 2011, so almost 10 years ago, more than 10 years ago, they decided in November 2011 that um, they need let us all the governments in the world, let us focus on three issues to see how we can advance progress on these three issues using One Health approach, an integrated One Health approach to animal health, human health, food systems, and the environment. How can we do that? Let us try to use One Health approach on three issues, and those three issues were rabies, antimicrobial resistance (AMR), and bird flu or avian influenza. So they decided to do this on three issues, which is really important. And no wonder, if you look at the past decade, you will see a lot of, milestones which to mark progress. At least I'm more familiar with somewhat on the antimicrobial resistance side, but definitely, for rabies also, there's been significant progress which has been made by governments in Southeast Asia, in Asia Pacific, for example, in ASEAN region, for instance, if you compare it with the earlier decades or years. So let us hope that more progress happens. And I just wanted to add one more thing that in November 2020, the Tripartite Alliance was joined by United Nations Environment Program, so UNEP. So UNEP has also joined this tripartite alliance of World Health Organization, World Organization for Animal Health, and United Nations Food and Agriculture Organization (FAO). So now there are four of them, and just the right agencies: the UN Agency on Health, UN Agencies on Environment, UN Agencies on Food and Agriculture, and the World Organization on Animal Health. All four of them are just the right agencies to coordinate a global, regional, country level, and with the field level response with the governments globally on to advance progress on One Health approach, an integrated One Health approach to human health, plant health, food systems, and the environment. We are reminded of the old Chinese proverb that the best time to plant a tree was 20 years ago, and the next best time is now. So let us hope that in January 2022, when less than 108 months are left to deliver on the promises made in the Sustainable Development Goals, our governments really accelerate progress on advance on translating One Health approach into really tangible outcomes of public health, on animal health, on food systems, on environment, on climate, and the words of Dr. Tedros, which he had so eloquently and boldly said that we cannot, protect human health. I'm again repeating the words of Dr. Tedros, that he had said that we cannot protect human health without considering the impact of human activities that disrupt ecosystems, encroach on habitats, and further drive climate change. And what are the human activities he was talking about, which is counterproductive to One Health? He's talking about pollution. He's talking about large-scale deforestation. He talked about intensified livestock production. He spoke about misuse of antimicrobials. He's talking about how world produces, consumes, and trades food. So thank you, Dr. Tedros, for saying that. Very, totally agree with you on that. And let us hope that these are not merely words. And let us hope that we can hold governments to account on these words too. So with the hope that we will see more progress on One Health in this coming less than 108 months. And uh, and we'll meet tomorrow again at 5 p.m. India time with the thoughts and views and perspectives on something that made us think. Bye till then, stay safe, stay well, stay protected, wear a mask, maintain social distancing, follow all COVID prevention protocols. It's a sad time for Omicron. My whole heart goes out to each one of you who is affected by Omicron. I think there's hardly anyone who can say who is not. So stay safe. Take care of yourself. Bye bye.